Hi, everybody. I don't know if you guys are here yet, but we are going to start the webinar on hypothyroidism. And just to get started, I'm just going to introduce myself. Some of you guys I know from being patient. Some of you guys I don't know, but maybe your Facebook friends are. But let's just talk a little bit about my background and what we're going to be talking about today. And if you see me looking down, it's because I have notes just to kind of keep me on track. And I'll be going there with that. So first of all, I work at Piedmont Wellness Center, which is in Greensboro. One of my specialties is in treating hypothyroidism. I treat it in a more natural kind of alternative way, in that I prefer to use more natural thyroid replacement, like things like Armour Thyroid, Nature-Throid, just compounded thyroid. So you'll rarely see me using Synthroid or some of the more pharmaceutical brands, although I'll do that from time to time. I've been doing this for a long time. We treat many other disorders as well as hypothyroidism, but that seems to be one of the areas that I really have become very proficient at. I've been even noted by Mary Shaman as one of the best thyroid providers on the East Coast. I was trained by some of the best in the world with my training out west. And I'm good buddies with those guys that write the books. So if you have questions, I am here to answer your questions. I will have an agenda of what we'll talk about, but you're welcome to ask anything that you want to ask. What I will encourage you to do is to type your question in, and I can see where one person has already typed a question. If anyone else that's listening is interested in that same question, there's a little +1 button that you can click on, and it'll tell me that more than one person is really interested in that question. So please feel free to ask anything. We are on a 20-second delay. So when I'm talking, you're not going to hear what I'm saying for about 20 seconds. So there's that little bit of delay with the webinar, and I may not hear what you're saying for 20 seconds. So if there is some delay, just know that that is normal. So we'll just go ahead and get started. I'm going to give you just a basic overview of hypothyroidism. And what hypothyroidism, of course, is an underactive thyroid. That can come from many different factors, some of that being genetic. There is a condition called Hashimoto's that some people genetically will get, and that's an autoimmune form of hypothyroid disease. And then the majority of hypothyroidism will come from extrinsic factors. The most common one that I see is toxins in the environment. Various toxins that we apply to the skin, that we eat, that we breathe every day. Especially heavy metals are so affecting the thyroid. And that's why I think that I'm seeing so many people with low functioning thyroids. Now, how do you get diagnosed with a hypothyroid disorder? That's the tricky part. It's because most traditional doctors will go by the TSH alone, which is thyroid stimulating hormone. And to be honest, that is a measurement of the pituitary function, not necessarily the thyroid gland. What I do is I look at the individual thyroid hormone levels. So I'm looking at the free T3, and this is important for you to write down if you go to a doctor and you want them to check. You want to have your free T3, your free T4, also initially your TSH, because you want to see if the pituitary is really affecting your thyroid function, and your reverse T3. So those 4 things: free T3, free T4, reverse T3, and those are the 3 that I will routinely check about every 3 months or so, and then initially the TSH. So those are the important ones, because we want to measure actually what your thyroid gland is producing. not what the pituitary is telling the brain that it needs to produce or telling the thyroid. That's important, but we want to know actually what your thyroid is producing, and is it in the right blends, and are you optimal? So when I'm looking at those levels, I'm not just wanting you to be on the scale. I mean, the scale can be this far apart, you know, at several points. If you're sitting just above normal, to me, that's unacceptable. I want you to be very optimal. And when you're optimal, things are just working right. So let's talk about a few other things just briefly that can cause hypothyroidism. Those are various viral infections. If you've had radiation from having certain cancers, that can destroy your thyroid gland. Various drugs can affect it, like lithium. That's a big one that'll affect it. Having your thyroid removed for whatever reason, of course, is going to diminish your hormone levels with your thyroid. Having Hashimoto's, we talked about, and pituitary dysfunction. But again, usually all of those things, underneath the surface, there's going to be some issue with toxins and heavy metals. One of the things that sometimes clues me into a person with hypothyroidism that's a little red flag is elevated cholesterol levels, because cholesterol is one of the top reasons to have high cholesterol is to have a low functioning thyroid. So I had a couple of sisters who were patients, and they both came to me with cholesterol levels. When they were twins, one 270, one was 235. Both of them had very suboptimal levels of thyroid hormones, and I told them both, you know, this is probably going to work on your cholesterol as well, because they had refused to do statin therapy, which I agree with. You know, I don't want them to do statin therapy. So they both came back in 3 months, repeated their cholesterol panel. After treating and optimizing their thyroid, the sister with the 270, her cholesterol was now 190. And the sister with the 230, her cholesterol was 170. So no other changes other than treating the thyroid. So that's a really, really big thing. All right, let's talk briefly, and then I'll get to questions. And I want to talk about symptoms of hypothyroidism. There are a lot of symptoms that people just don't realize that could be related to hypothyroidism. Weight gain is a very common one, but it's not always, you know, a symptom. But that stubborn weight, that you know that you're eating right, you know that you're exercising, but it is just not coming off. The thyroid controls a lot of our metabolism, so you may have a low functioning thyroid. Increased sensitivity to cold. If you're constantly wearing a sweater, if people are telling you have cold hands and feet, you know, if you're freezing and have to wear blankets even in the summertime, chances are your thyroid is low. In fact, you can test that by taking your basal body temperature every morning. This is before you get out of bed in the morning. You want to have a thermometer handy, and your temperature should be at least 97.6 when you wake up. So if it's below that, chances are your thyroid is low. In fact, there's a protocol called Wilson's protocol of thyroid treatment that some people will follow, and they'll keep increasing their dose of Armour thyroid until their body temperature reaches a certain level. Constipation is a very common one. I've found people who have suffered with constipation for years, and then suddenly their thyroid is optimized and that completely goes away. Muscle weakness, joint pain, other types of body pain, even fibromyalgia type pain can be related to having a low functioning thyroid. One of the most common things I see is a little depression in people, sometimes major depression in people. Fatigue, honestly, one of the most common symptoms as well. Dry skin, pale skin. You'll see a lot of people who will have a puffy face, especially under eye pockets will be puffy because you retain fluid when you have a low functioning thyroid. A hoarseness to your voice can be associated with a low functioning thyroid, because when people have a low functioning thyroid, oftentimes they'll have some edema or a goiter, which is like a little cystic formation on the thyroid due to underactiveness. brittle fingernails and nails. If you're a woman having periods, sometimes your periods will be screwy, and excessive bleeding, even infertility. The infertility patients that I have treated, and very successfully, the only different thing that I've really looked at to optimize that other physicians have not is their thyroid and getting it really optimal, because I think it has so much to do with ovulation. A slow speech, foggy brain, so many things, thinning of the eyebrows, thinning of pubic hair. Those are very common things. So let me take a break from my agenda, and I'm going to answer the first question, which is what can be done nutritionally for hypothyroid disease? Well, I'm going to answer it this way because this applies to all area of health, really. You want to eat as clean and green as you possibly can. And I know you've heard that. It's probably become just routine to hear people say that, but it's so true. I think we get a lot of toxins from our environment through our food. So the more organic you can go, the more optimal your body is going to be, because that's going to prevent a lot of the toxins that are affecting the thyroid. And again, that's what, when I go digging for the underneath cause of hypothyroidism or any of the other disorders leading to it, heavy metal toxins and just chemical contaminants and toxins are at the top of the list, because our thyroid is very glandular, as well as our adrenal gland, and both of those two really play off of each other. It's not uncommon to have hypothyroidism and an adrenal fatigue at the same time, because toxins affect both of those the very same way. As far as nutritional supplements, really, iodine, I think, is a very important supplement. 75% of Americans are deficient in iodine, so it's really critical to get enough iodine for our thyroid functioning. I like to give patients something called iodoral, which is a blend of iodine and potassium iodide, and it's 12.5 milligrams. What you'll find in most health food stores is an iodine supplement alone, which is going to be in micrograms, which is a very, very low dose. So 12.5 milligrams of an iodoral is very common. Selenium. When we're looking at the optimal thyroid breakdown, we are relying on the parathyroid glands, and I'm going to pull up a picture. Let's see if I can find it. Let's see. Okay, this is a picture of what the thyroid actually looks like. And for those of you who aren't, real familiar with your anatomy, this is right here, kind of where the Adam's apple is, or just kind of below it. And you can see that it's lobular. It has like little lobules in it, and it extends to both sides, kind of like wings on either side of the trachea. You can't see this, but right behind the thyroid gland, you'll have parathyroid glands. And this is where selenium will come into play. Selenium helps your parathyroid glands. Selenium helps your parathyroid glands produce more T3. So I'm not sure if you guys actually saw that picture. Let me pull it back up. Okay. Hopefully you can see it. Hopefully you can see it now. All right. So the pink thing that you're looking at that's a wing-shaped is your thyroid gland, and it's fairly large. It's roughly the size of kind of a walnut or so on either side of the trachea, and it extends kind of back, and then the parathyroid glands are behind that, and those are the ones that convert the T4 into T3. So all right, let me see if I can get back to my other picture. There we go. Okay, so hopefully that is going to answer at least the nutritional question. a lot of people will say, limit things like broccoli. I have a hard time telling someone not to eat broccoli because it's those kind of vegetables, the cruciferous vegetables, are so good for us. So when I go looking at nutrition, I'm going to be looking, instead of removing things, more along the lines of optimizing things. Okay, next question. And I hope that answered the basics of your question. So selenium and iodine are two of the biggies. And so Stacy is asking, and hi Stacy, can Lyme cause problems for your thyroid? That's a good question, because I know a lot of you guys deal with Lyme disease. I deal with Lyme disease, and I have a low functioning thyroid. I think the answer to that question is going to be more the things that lead your body to develop chronic Lyme disease can also lead to developing hypothyroidism, if that makes sense. And a lot of times at the basis of that, we're looking at genetic mutations, which a lot of you are aware of. The MTHFR mutation is very, very common with hypothyroidism. What's interesting is that mutation also causes you to be heavy metal toxic. And heavy metal toxins, again, can be the underlying reason for your hypothyroidism to begin with, because it is decreasing the functioning of your thyroid. So Lyme in itself, I don't believe will cause hypothyroidism. It's more, again, along the lines of what is causing the Lyme to not go away, and what is causing the immune system to allow your body to get Lyme disease to begin with. And we'll have to do a webinar on Lyme disease one day, because that's just a whole nother subject, and one that I'm very passionate about, as many of you guys know. All right, so I'm going to continue with some of my notes, and if if any of you guys have more questions or more specific questions on what you've already asked, then just pop up a question and I'll address it. So, am I at risk for hypothyroidism? Really, yeah. Living in this environment, living in our country, we are so much more exposed to toxins today than ever before. We live in a very industrialized nation, and we're wanting the biggest and the best and the latest and the greatest of everything, but that's coming with a price that we're paying. And that price is often a toxic environment, unfortunately, and our rivers are so polluted now. Even the oceans, are getting really polluted. I just recently, well, I guess within the past 2 years, had a reaction to scallops, and I've had that twice now. I'm not allergic to iodine. I'm not allergic to shellfish. It was the toxin that the scallop had absorbed on the bottom of the ocean that caused that anaphylactic reaction in me. So those types of things greatly impact the body's normal functioning process. So the thyroid, the adrenal glands, all of those are going to be affected, by toxins. So anybody, in essence, living in the United States is somewhat at risk. Another area that is going to be, I think, a player, at least in Hashimoto's, is going to be gluten. And what we have found is in the last 12 to 15 years, we have seen 40% more gluten in our diets than we ever did before. A lot of that's coming from the hybridization of the wheat, genetically modified foods in our diet. I don't think our body is meant to ingest things like Roundup. When we blend that with the seeds, I think it's doing a whole lot more damage than the powers that be, want to claim that it is, because we've seen about a 40% increase in autoimmune illnesses, Hashimoto's being one of those, and that's a condition where the body is attacking the thyroid, and we would know that by checking your thyroid antibody levels. Of course, if you've got high cholesterol, that can be an indicator. If you smoke, smoking is absolutely one of the worst things you can do, but especially for toxins. out of a cigarette and smoke, you're going to find that there are so many heavy metals that your body is absorbing. And those are going to, again, be going, directly to these glandular areas of the body, because the body oftentimes can't clear them, especially if you have this mutation. There was a question that popped up and it disappeared, so I don't know if I did something to it, but it was about stress. I think the question was, can stress aggravate the thyroid? Stress can aggravate any condition in the body, because when you have a stress response, you're dealing with the adrenal glands. Those fight or flight hormones, such as cortisol, adrenaline, epinephrine, DHEA, a lot of those are being impacted by stress. When you have adrenal fatigue, which is what happens when you have too much stress or adrenal stress, that has a direct relationship to the thyroid. So absolutely, stress can affect your thyroid. I still believe that there's some underlying component there, but stress is definitely a factor. So decrease your stress. Women age 35 to 55 commonly are those that are diagnosed with hypothyroidism, and I think a lot of you listening right now are probably some of those, because you fall in that age range. Childbirth within the last 6 months. It's not uncommon for women to develop a low-functioning thyroid, either with pregnancy or postpartum. And it's often one of the causes of postpartum depression. I know with me that happened after my last baby, is when my thyroid kind of went astray. Let's see. Again, we said autoimmune illnesses. You'll be more likely to have hypothyroidism with other autoimmune illnesses like lupus, rheumatoid arthritis, various conditions of the intestines, those kinds of things. Family history of thyroid disease. If you have a mother, an aunt, a cousin, and several people in your family have hypothyroidism, if you're symptomatic, chances are you might also. And then previous thyroid problems. You can't, I have so many patients that come to me and said, well, I had radioactive stuff implanted in my thyroid, and then they gave me medicine for a while, and then they said I didn't need it anymore. I always kind of chuckle at that, because it's kind of like diabetes. If you've got diabetes, and let's say you're on insulin, and we're treating you with insulin, and we, through insulin, are able to get your blood sugar to, let's say, 120. We're not going to say, oh, good, your blood sugar is 120, now let's take you off the insulin. Doesn't make sense. So usually when you're on thyroid medication, unless we're dealing with the underlying causes, again, genetic, toxins, sometimes you'll have to be on medicine for a long, long time, or forever. Aging is a factor in the thyroid. So if you're menopausal, if you're of the andropause age, part of an anti-aging workup is going to be looking at the thyroid, because those thyroid levels do decline, as do other hormones in the body. To me, it's really, really important to address all of the hormones, because if I wish I had my chart in here, and next time I do this, I'll have a chart up, but the body is like a spider web. So when you're looking at the thyroid, you cannot completely address the thyroid without looking at your adrenals, without looking at your what we call sex steroids, which are your female and male hormones, because all of those things play off of each other. And you just have to look at all of it. That's why it's important to go to a provider that's open at looking at an integrative approach at the body, and that's what we do here. When I do an initial workup, or Leslie, or whoever would be seeing you, we're going to be looking at a pretty good bunch of labs, and I'm sure some of you guys are laughing because when you go to your lab, they may draw 10 or 12 vials of blood, and you feel like you need a transfusion afterwards. But truth be known, we're just looking at some very, very complex processes in the body that play off of each other, and it's important for us to see that. For instance, vitamin D. A lot of people don't know that vitamin D levels being low can affect the thyroid, because it's a hormone in the body, and all hormones are intertwined and have a play off of each other. So, when you come see us, we're not going to only look at your thyroid. Some people will come and say, well, I only wanted I really only want to look at my hormones. That's all I'm interested in. Well, we need to look at everything. Or somebody might come in and say, well, I just want to come in for weight loss. I want you to prescribe me Phentermine or HCG diet. Well, let's look at the causes for your weight gain in the first place, which could be your low functioning thyroid, which could be hormones that have gone astray. So we're going to look at all of it. Pituitary gland is a big part of that as well. So, we'll measure your pituitary functioning through looking at your adrenals and looking at your cortisol levels. Some of you may have been told that, oh, your thyroid is fine. You've got normal levels, even though you have probably 10 of the symptoms that I described earlier of hypothyroidism. So what do you do from there? Well, you first request that your doctor perform those labs that I told you in the beginning, the free T3, the free T4, the reverse T3. I would also initially do thyroid antibodies and a TSH initially. And if those things are not optimal, and you can kind of tell that yourself when you look at the lab values on your lab sheet. If your free T3, let's say the range goes from 1 to 5 or 4. I don't want you just being 1. I want you to be at least in that 75th percentile of the top number. So if any of you have labs and you want to look at those, the free T3 and the free T4 should be very, very optimal with that. What are steps to finding out if you're hypothyroid? Of course, the first is going to be contacting your physician or your healthcare provider. If you don't feel confident in their abilities to tell you yes or no, then call us, because that's our specialty. That's what we do. We deal with all of that. Here, diagnostic testing is a really big, important part of it. But I also believe in the old hands-on looking at the body and diagnosing. I have several people that if I looked at just a piece of paper only, we would never know that their thyroid was low functioning. So if the thyroid feels slightly enlarged or spongy, kind of cystic, if they're having some swelling and edema in the legs, one of the big ways if somebody can help you with this is to take the bottom of your foot and hold your foot up straight and then run a finger or a pencil. And it's hard for you to do this yourself, but run it up there. And then if your toes curl in, that's called a Babinski reflex. And if that doesn't happen or it's very diminished, oftentimes that's associated with a low functioning thyroid. Just looking at someone, if they've got the puffy eyes, and along with their symptoms, I'll go ahead and do a trial of thyroid medication unless I see that they're hyperthyroid. And I'll be honest, in close to 6,000 patients, I have never seen a hyperthyroid patient, because hyperthyroidism generally has a hypothyroidism component to it. And that's where reverse T3 is going to come in. I want to talk for just a second about reverse T3. And what that is it's a dysfunctional thyroid hormone that I've really started pushing and checking in the last couple of years. Because sometimes we'll never know that you've got elevated reverse T3 levels without checking that level. But the T3, again, is the most important part of the thyroid hormones. In fact, some people in my circles are only treating with T3 just to optimize the T3 part of it. I still believe in some T4 as well, but really focusing in on the T3. That can be an important part of weight loss. If you are on Armour or any other thyroid medication, it doesn't seem to be stimulating you to lose weight or get back down to normal, then it could be you're not on enough T3. But reverse T3 is a byproduct of the T4 that is taking the receptor side of the T3. And if it does that, it's dysfunctional, and your T3 is really of no use to you. So that's why we check the reverse T3. Anything over 15, I'm going to be, trying to fix. Normal goes up to about 24. So you'll see there's not a lot of wiggle room for reverse T3. I just don't want you to have it. When I was at the World Congress of Anti-Aging Medicine about a month ago or so, maybe 6 weeks ago, some of my buddies were speaking. A doctor from Belgium, who's named Dr. Hertog, is one of the world's leading authorities on thyroid and weight loss. And he spoke as to the effect of T3 with weight loss clinics. And a lot of clinics are actually giving thyroid medications, specifically T3, to boost their metabolism and to really make a big impact on a patient's weight loss. Blood testing, is definitely going to be a component of your workup. Looking at you, reading all of your history, your symptoms, is going to be a big part of it. Nutritional assessment. If you've got a lot of nutritional deficiencies, definitely that can contribute to a low functioning thyroid. Hair analysis for heavy metals. And because I believe that that's such a big component to the thyroid, let's talk for a moment about toxins in the environment. Heavy metals like lead, mercury, cadmium, aluminum, any of those things are going to be settling in these glands like the thyroid. There are two ways really to test for those. You cannot do a blood test for heavy metals because they're just not circulating. They get stored in the body. If you've got high circulating levels of heavy metals, that means you had just an immediate recent exposure. And what we're talking about are things that you've been exposed to for years. So testing for heavy metals can involve a hair analysis, which is where you just snip a little bit of your hair and mill it off, and then the company analyzes it for heavy metals and minerals. So that's one way. The tried and true way is to come in and do full-blown heavy metal testing, which is where you come in, we start an IV, we administer something called EDTA and a little bit of DMPS. Immediately after that, you will collect your urine for 6 hours. Those things are provoking the heavy metals out of the storing places to a small degree and allowing us to measure them. So that's the more tried and true. It's called a urine provocation test. Some of these tests aren't cheap, but there are no ways other than those to look at that. Hair analysis is very inexpensive. I think it's maybe $100 or so. The urine provocation test is more along the lines of $300. But it really profoundly good test, important test to do. If you're found to have heavy metals, then it's getting important to pull those out. And we can pull those out. It's a process called chelation. I have seen thyroid levels improve dramatically through chelation. It's because we're pulling out the offending agent. Now, sometimes they do damage, and sometimes there's really no repairing the damage that they did, and in those cases, you may be looking at needing to replace thyroid hormones, for the rest of your life. But in a large majority of patients, simply removing the offending agents can so enhance your health, especially your thyroid function. I've seen kidney damage that people have told them, well, you're in kidney failure. There's not a lot of reversing that, but I've seen it reversed through the simple process of chelation. And chelation doesn't have to be time consuming. It doesn't have to be very expensive. It can be if you chose to do, all IV chelation. But we recommend a protocol of a suppository of EDTA followed by some oral capsules of something called the MSA the next day. And you do that once a week. And you might have to do that for a year. But, it's removing a lifetime full of toxins that have affected your health today. Let's see. Again, looking at the big picture is the important thing, because in my mind, if you suffer from hypothyroidism, there are probably other factors and illnesses and areas of the body that are being affected as well. And many of you know that because you're my patients, and we're treating numerous things. Really, it's all about balance. It's all about, looking at the body and looking at your blood work and reaching a goal of everything being balanced. And if something's out of balance, we're going to work diligently to work on it. A lot of people want to know, diet-wise, what can I do diet-wise to positively affect my thyroid? Coconut oil is a really good one. I have patients who chose to do a teaspoonful of coconut oil every day, and it had the same effect on some patients, a handful, that a thyroid medication would, because coconut oil really revs up your thyroid. Good thing to know. So if you're not doing coconut oil, it can also rev it up too much if you're on medication. So you just have to look at symptoms. One of the most powerful things I can see diet-wise is to follow a gluten-free diet. And we talked about, the 40% more gluten that's in our diet today versus several years ago. But really, we don't need gluten. Our powers that be want a lot of gluten because it makes things thicker and fluffier. But truth be known, it's killing us. We just don't need all that gluten in our diet, and our body forms a reaction to it. And inflammation is that reaction, and inflammation greatly impacts the thyroid. So find out what you're allergic to. We do a test here also called LEAP, L-E-A-P, or one called ALCAT. Both of these are food allergy and sensitivity profiles. We're testing a ton of foods, but also additives to foods. We're testing additives to foods that can affect other areas of the body. So sometimes by getting off of something that you're sensitive to, it will enhance everything else in the body. When I'm looking at you as a patient, you're sitting in front of me, I'm going to be looking at what is your nutritional status, what is your diet like. A lot of people, look at me, and when I tell them, well, Joe, I want you to go on a gluten-free diet, and they'll look at me and they'll, basically think I just told them to fly to the moon, because they think it's so scary and it's so hard to do. But if you break it apart and you look at what has gluten in it, it's basically wheat and a few grains. So all of your dairy, all of your meats, all of your vegetables, all of those things are not going to contain gluten. So simply eliminating breads and crackers and pastry type things, unless they are made from gluten-free ingredients. If you eat out a lot of fast food, it's going to be difficult for you to be gluten-free. If you cook at home, it's going to be a lot easier to be gluten-free because you can be in control of it, and it's really not that hard, I promise. There's a great book called The Wheat Belly, that I love, and it's been out for a few years, but I still think it's just a great book. It'll make you mad because it'll show you, some of the political reasons behind why we have so much gluten. So I'm going to be looking at your nutrition. I'm going to be looking at your toxin levels, and to get rid of those toxins, I'm going to be looking at your hormones and balancing all of that. I'm going to be making sure that your immune system is nice and strong, because without a strong immune system, everything can go astray. And I think one of the biggest reasons for chronic fatigue syndrome lies within the immune system. And then, you know, just looking at your overall lifestyle fitness and the whole mind-body connection. And, you know, are you doing any exercise? Honestly, I see people of all ages, and those that are the healthiest are the ones that exercise. And yes, it takes time, but it's so crucial. It's so crucial to your health, as especially men, because it's going to keep your testosterone levels optimal. And again, all of that affects your thyroid. All of it affects your thyroid. So, one last little tidbit, and if any of you still have questions, feel free to ask them. But we are offering a free, if some of you are not patients but want to talk to someone in our practice about your thyroid and what's involved and could you possibly have a low functioning thyroid, we're offering a free 10-minute phone evaluation. So you can call our office at 336-632-9944. You can also go to Piedmont Wellness Centers plural .com, and you can find information on doing that on the website, and then sign up. Somebody will call you and we'll go from there. So I don't see any more questions, so it was a pleasure talking to you guys, and I look forward to seeing a lot of you in clinic, and hopefully we've answered lots of questions on the thyroid. One real quick thing that popped up, and this may be something you haven't thought of, but why am I so adamant about natural thyroid replacement versus pharmaceuticals like Synthroid? And I'm all about the body identifying something that we're taking into the body as looking like its own natural hormones. So that's why I prescribe bioidentical hormones, because they look exactly like our hormones. Well, when you're getting a raw desiccated thyroid glandular like Armour thyroid, our body is going to be looking at it as if it is our own thyroid hormones, and you're going to respond so much better to it. There are a handful of patients that still will require Synthroid, and for whatever reason their body didn't respond to Armour, but I bet 95% of my patients are on either a compounded natural thyroid or things like Armour or Nature-Throid. Most people just do so much better. And Synthroid, just so you'll know, only has T4 in it. Going back, T4 is not the active thyroid hormone. T3 is. So if you're getting a lot of T4 but your body's not converting it to T3, it's doing you no good. So if you still don't feel great and you're on Synthroid, get somebody to check your real levels and see, is your Synthroid being converted into the real active form called T3. All right, nice to talk to you guys. Hopefully we'll do another webinar soon. We'll have several topics. Just be checking our website or Facebook page, and we'll go from there. And have a great day. Bye.